Hi, everyone. My name is Blake Cadwell. I am the co-founder and CEO at Soundly.com. And today I'm joined by Dr. Amy Sarow. And we're going to be talking about types of hearing loss. There are several different types of hearing loss. And if you're someone who's experiencing hearing loss, maybe you're missing speech sounds or having a difficult time hearing the things in your life, you might be wondering what type of hearing loss you have and if there are various types. The answer is yes, and we're going to talk about all of that in this video. So we'll jump right in. And the first place we're going to look is the three big categories of hearing loss. So there are three main types. The first is sensorineural hearing loss. And Dr. Amy, maybe you can start there and talk to us about what sensorineural hearing loss is and where it comes from.
Sensorineural hearing loss comes from the inner ear. So it has to do with, we have the outer ear, we have the ear canal, we have the middle ear, and then we have the cochlea where we have those little hair cells. So damage to the inner ear can happen because of noise, for example, loud sounds, or over time. It can also happen with age, and there are other reasons why that can happen, but it stems from the inner ear.
So this is where sensorineural hearing loss is where those hair cells are just not responding the way that they used to, or maybe they've never responded, but it's those hair cells that are not responding. Is that right? This is really about the kind of hair cells inside the ear.
Generally speaking, yes, that would be the reason. There are more rare reasons why you can have a type of inner ear hearing loss. So, for example, a benign growth of cells on the hearing nerve is more of a neural portion. So you have sensory neural made of sensory and neural. So there can be other reasons why, but in many cases, yes, it's because of those little hair cells in the inner ear. They're not receiving the sound, or they need more volume to receive it, which sometimes means also that when we increase the volume, the sound that's coming through is not as crystal clear as it used to be, as it's making its way up to the brain. Yeah.
That makes a lot of sense. So that's sensorineural. The second big category of hearing loss is conductive hearing loss. Can you talk to us about what conductive hearing loss is and how it differs from sensorineural?
So as I mentioned, there are different parts to the ear. You have the outer ear, we have the middle ear, and we have the inner ear. In the case of conductive hearing loss, the inner ear is working fine. It's a problem with having the sound get to the inner ear. So there's usually some type of blockage. Sometimes that's a temporary thing. For example, if you have wax that is occluding your ear canal, sound is not passing through as easily as it would without that. Other times, an ear infection, and then once that resolves, the middle ear space is filled with air in a healthy middle ear. But when you have fluid, that is preventing the sound from coming through the way it normally does. So that is conductive hearing loss, when it's not able to transmit the sound to the inner ear effectively.
And is it fair to say that I guess putting a pair of earplugs in is in a way a sort of a simulation of conductive hearing loss? It's obviously artificial, but that's kind of how I think about it. Is that a way you also think about it?
Correct. Yeah. So when you plug up your ear with those earplugs, you're preventing the sound from coming in as loudly as it would without earplugs. And so yes, you're attenuating the volume, and so that gives yourself a temporary conductive hearing loss.
Got it. And then there's a third kind of big category, and that's a mixed hearing loss. And to my understanding, it's really a mix of both sensorineural and conductive. Can you talk to us a little bit about that?
That's correct. So this is a combination of both of those types of hearing loss. So that means that even when the sound gets to your inner ear, there's still it's still not as clear or loud as it would be for someone with normal hearing. And so you have that portion of it, but then also there's a portion in the middle ear or the outer ear that's blocking the sound from coming through. So we get a little bit of both. The sound has trouble getting to the inner ear, but even once it does, it may not be as clear or have less volume than you may need to be able to understand clearly. So an example of this could be someone who has sensorineural hearing loss, and perhaps they've developed an ear infection. Then we have a combination of both of those things happening at the same time.
That makes sense. So I guess if I'm someone who's experiencing hearing loss or someone I know is experiencing hearing loss, is there one of these that is the most common, I guess, or one of these three types showing up the most often? Obviously, it could be any of them, but is one of these the most common, I guess, among folks with hearing loss?
We tend to see sensorineural hearing loss most often. But yeah, certainly, I've worked in settings where, like in a busy neurotology clinic, there we're seeing a lot of surgical ears or unusual situations in the ear. And perhaps there we're seeing more of those other types. But in general, sensorineural hearing loss is the most common.
Got it. Yeah, that's very helpful. So another way folks talk about hearing loss is kind of through an audiogram or hearing chart. And, typically this applies most directly to those with sensory neural hearing loss. I know for myself, I have a cookie bite hearing. So if you've never seen a hearing loss chart, kind of tracks your ability to hear across different frequencies. Mine dips down in the middle, and it's pretty good on the high frequencies and the low frequencies. And each person with hearing loss has a slightly different shape, but there are some patterns. Dr. Amy, can you talk to us about some of the common sort of hearing chart or audiogram patterns that folks might see if they do have a sensory neural hearing loss?
Certainly, one of the most common types is a sloping pattern, which means that you hear best in the low frequencies. So you hear men's voices well, or better than more easily than women's voices. You may hear that someone is saying something, but it's not clear the ends of the words, the consonant sounds. And that's because there's some high frequency hearing loss that follows that sloping pattern. So that's certainly a common type. And with age, that's the most common type of hearing loss that we tend to see, which is also called presbycusis. Another type of hearing loss that you might see is called reverse slope, which means that it slopes in the opposite direction, meaning that the hearing loss is greatest in the low frequencies and becomes increasingly less as we go higher in frequency. So it's a more unusual configuration of hearing loss, but it does exist out there. So the low frequencies would be where the vowel sounds are. Again, that's where men's voices are. And so those would sound softer to someone with a reverse slope hearing loss. Then we have something called a notched pattern, which we tend to see this in people who've had a noise history. So perhaps they've gone to the gun range or been around a lot of loud sounds, loud concerts. Around the 2 to 4,000 hertz range, that's where we see a little dip, and then it comes back up. So low frequency hearing is, normal perhaps, and then out in the really high frequencies, it comes back up. But then in that 2 to 4K region, we see a dip. And so that makes it difficult for people, especially when they're in background noise. Maybe they hear fine and quiet, but then when we combine the background noise with that missing piece of the consonants, the high frequency sounds, it makes it hard to understand. And then you've already mentioned the cookie bite, which is that type of hearing loss where you have the greatest degree of hearing loss in the middle, with normal or better hearing in the low frequencies, and then the same in the high frequencies. Unilateral hearing loss, that's going to be somebody who has, let's say, completely normal hearing on one side, and they have some degree of hearing loss only in one ear. And that is challenging, especially if someone is talking to the poor ear side, if you're trying to listen to conversation, especially in the presence of background noise. Localizing sound will be challenging there because we hear best when both ears hear about the same in each ear, getting those cues about which direction, the speaker is coming from or a sound is coming from. And then we have asymmetric hearing loss, which is when you have hearing loss in both ears, but one ear is worse than the other. So that would be, a similar situation to unilateral hearing loss, where it's difficult to localize sound, but there would be a greater degree of difficulty because we do have hearing loss in both ears.
That's very helpful. Thank you for the breakdown. I think, for those who are watching, if you're not familiar with all of these terms, I think it's important to know that each person's hearing loss is a little bit different. And, it was helpful for me as someone with hearing loss to know that there's these these three larger groupings, the sensorineural, conductive, and then mixed. And then within sensorineural, there's a whole series of patterns that can emerge around your hearing, and it really can change the way you should treat your ears. And I know for myself, someone who needs a boost in the mid frequencies, having a professional or product that can boost those frequencies, but not boost too much the lows and the highs, that it becomes uncomfortable. That's really important for me. And for other folks, it's important to bring kind of that slope up. So I think for that reason, if you're not sure what type of hearing loss you have, it's very much a good investment of time and energy to go see a local doctor and get your hearing tested. I know Dr. Amy typically recommends folks do that at 50 to just establish a baseline. You can also take online hearing tests, and we'll link one in the notes below. But we hope this has been helpful to give you a baseline or an understanding of what different types of hearing loss exists. And we really appreciate your time, Dr. Amy, in explaining all of it to us today. So thank you for your time, and good luck.